morning. My name is Camila. I will be your nurse today. Today we are doing a full physical examination from your head to your toe. Before we continue, can I please get you to verify your first and last name and your date of birth?
My name is Annie Khan, date of birth July 11, 1991.
Perfect. Thank you. Today's examination will contain some minor touching. I will be touching your entire body, certain areas. Are you okay with that?
Yes.
Okay, great. Do you need to use the bathroom to empty your bladder before we start?
No, I'm good.
No?
thanks.
Okay. Do you have any pain right now?
No.
Okay, great. I can actually get you to sit on the bed.
Okay.
Okay, perfect. My patient's physical appearance, she is 30 years old and her physical appearances matches her age. Her skin matches her ethnicity, and I can see that she has no deformities, which is good. And her body is, you are around 5'3".
Mm-hmm.
Okay, so that's good. Her height is good for her age. And then she looks well nourished, which is good. And she's very clean. Everything seems fine. I don't see any physical deformities. And do you know today's date?
Yeah, December 1st.
Okay, perfect. So my patient is oriented ×3, and as my patient was walking to sit on the bed, I checked, I examined for her gait and range of motion, which is intact, and she's breathing well. Her respiration is fine. I don't see any sign of distress. Her lips are pink, so there's no cyanosis, which means her breathing is good. So the next thing we will do is I will quickly examine your head and your scalp and your skull. Okay, so I can see that my patient's head is symmetrical. Her hair is black in color. I don't see any physical abnormalities. The next thing I will do is quickly palpate your head, and you let me know if you have any pain or any tenderness, okay?
Okay.
Any pain?
No.
Any tenderness?
No.
Okay, great. So I can see that her patient's hair is well distributed, and I don't see any, there is no edemas, there is no lesions, and she did not have any pain, which is good, and hair is equally distributed. The next thing we will do is I will quickly examine your cranial nerve 7, that is your facial nerves. I need you to smile for me. Great. And show me your teeth. Okay. Frown. Okay, lift your eyebrows. Close your eyes shut really tight. Perfect. And poof your cheeks for me. Okay, perfect. And we saw that my patient was able to do that without any difficulties, which is good. The next thing we will do is we will quickly examine your eyes, and then we will do your ears, nose, mouth, and everything else we'll take from there. So I can see your eyes are, your lashes are well distributed. They are the same color as your hair, and your lids are fine. I don't see any redness, any swelling. If you can look up for me. Okay, perfect. And I don't see any veins, and her sclera is white and conjunctiva is pink in color. So the next thing we'll do is we'll quickly check your pupils. What I will do is I will light, this will be your cranial nerve 3. I will light the pin light and I will examine your pupil, okay? So perfect. My patient's pupil is symmetrical. They are round in shape, and they actually constricted and dilated as I place the light on her eyes. So we will quickly do a accommodation test. I need you to look straight on the wall, and as I mentioned, you just change your focus to my finger, okay? Okay, now. Okay, perfect. So her accommodation is intact. Her pupils dilated and constricted from a 4 to a 3, which is good. And while I was placing the light, I also examined for the cranial nerve 3, her direct and confrontation test was as well intact. So now we will do a cardinal gaze examination. So I need you to look straight. Do not move your head and your face. Just move your eyes. We will examine the 6 different areas. Okay. Okay, so my patient did that well without any difficulties. The next thing we will do is we will do a cranial nerve examination number 2. This will be consisting of a Snellen chart and also a confrontation test. I will place the chart, and if you can read number 8 for me.
DEFPUTEC.
Okay, perfect. So my patient was able to do that without any difficulty. She is 20 out of 20. And the other one will be a confrontation test as well. So what you will do is you will close one eye and you will let me know when you actually see my fingers, okay?
Yep.
Now?
Yep. Yep.
Okay, so we'll do the other side?
Yep. Yep.
Okay, good. So that is intact. My patient was able to see her cranial nerve is intact. So the next thing we will do is we'll quickly examine your ears. First, I will inspect. I can see that my patient's ears are symmetrical and the size is matching with her face structure. And I don't see any dryness. I don't see any discharge, which is good. Today's test, since we are limited with time, I will only do one side instead of bilaterally. So what I will do next is I will palpate your tragus and your ear, pinna and auricles, and let me know if you have any pain or any tenderness, okay? Any pain?
Nope.
Pain? No. No? No? Okay, great. Okay, so my patient had no pain, no tenderness. The next thing I will do is I will quickly examine your external auditory canal and tympanic membrane for any abnormalities, okay? Okay, good. Okay, perfect. So my patient's external auditory canal was pinkish in color. There is no discharge. There is no lesions, no edema, and also I examined her tympanic membrane, which is pearly gray. There is no bulging. There is no discharge, which is great. Now we will do a quick hearing test. I will whisper 3 words in your ears, and you repeat after me. Okay?
Okay.
All right. Armchair.
Armchair.
Chair.
Chair.
Frame.
Frame.
Okay, perfect. And we can see that my patient was able to do that without any difficulties. So now we will do is, I would repeat on the other ear, but since we are limited on time, I will just do one ear. The other thing we will do is we will examine cranial nerve 8. Which is consisting of a Weber's test and Renee's test. So I have my tuning fork. I'm going to activate it, and let me know when you hear a buzzing sound. I will place this on the midline of your head when you hear the buzzing sound, if it's equal on each side, okay?
I hear it equally on each side.
Okay, so my patient is able to hear the buzzing sound equally on each side, which is good. And the other thing we will do is Renee test. Okay, I will place this in 2 different areas, and you let me know which one you can hear faster, okay?
I hear it.
Okay.
I hear it.
Okay, so we can see that it took her a little longer to hear when we were doing the air conduction. So that is intact as well. So the next thing we will do is we will examine your nose. I can see that your nose is symmetrical. I don't see any lesions. I don't see any involuntary movement of your muscles, which is good. Now I will quickly examine your interior nose. Okay, so that is good. And I saw that your nasal septum is on the midline. I did not see any polyps. It's pink in color. I did not see any discharge, which is good. Now we will do a quick examination of cranial nerve 1, which is patency and smell. So what I need you to do is close one eye and, one nose and sniff. Perfect. And the other side. Okay, perfect. So my patient was able to do that, which is good. The next thing we will do is we will do a smell test. So you will do the same thing. You'll close your eyes and I will place 2 different objects and you let me know what you smell. Okay, what do you smell?
Candle.
Okay, perfect. And the other side, close your other nose, nostrils. Okay.
Nail polish.
Okay, perfect. So my patient was able to do that, and her smell is intact. She does not have any difficulties. The next thing we will do is we will examine your mouth and pharynx. So I will start by inspecting your lips. Okay, so I can see that your lips are pink. I don't see any chips and they seem well hydrated. Can you show me your teeth and your gum? Perfect. So I can see that my patient's teeth are white in color. There is no dental caries, no cavities, and the gums are pink in color. I did not see any bleeding. There's no lesions. There's no edema, which is good. And the next thing I need you to do is open your mouth for me and say ah. Okay, perfect. Thank you. So I saw that my patient's soft palates are pink in color and hard palates are whitish in color. And also I examined my patient's tongue, which seems pink in color and they seem hydrated. I did not see any cuts, any lesions, or any edema. And while my patient opened her mouth and said, ah, I examined her cranial nerve 9 and 10, which shows that uvula and her soft palate rose, which is a good sign, which means her cranial nerves are intact. And now what I need you to do is stick your tongue out and move it side to side. Okay, perfect. So my patient's tongue is midline and she was able to move her tongue without any difficulties. And can I also get you to say light, tight, and dynamite?
Light, tight, dynamite.
Okay, perfect. And we can see that my patient has no tremor, which is good. That is our examination for mouth. The next thing we will do is we'll quickly examine your neck. Okay, so I can see that my patient has no lesions. I don't see any visible masses. I don't see any pulsation, and her trachea is midline, and I don't see any enlargement of her thyroid gland, which is good. And I will quickly palpate your neck, and you let me know if you have any pain, okay?
Okay.
Any pain?
No.
Okay, great. So at the meantime, I will also check her carotid arteries. Okay, so her artery is strong and it is equal, which is good. And the other thing we will do is I will quickly examine your cranial nerve 11, which is your accessory muscles. So what I need you to do is you move your head from side to side. rotate it. Yeah, perfect. And I will place my hand on top of your shoulder, and if you can shrug your shoulder against my resistance, okay? Okay, perfect. So my patient was able to do that well. And the next thing we will do is we will do a quick integumentary examination of your upper extremities. So the first thing I will do is I will inspect. I can see that my patient has no lesions, there's no scars, there's no muscle mass, which is good. And I don't see any skeletal and deformities. Now I will quickly gently palpate, and please let me know if you have any pain or any tenderness, okay? No pain?
No.
No? Okay, your shoulders. Everything is good? Okay, so the temperature seemed normal. I did not feel any muscle mass. I did not feel any, I don't see any lesions. I don't see any pulsation anywhere, which is good. So the next thing we will do is I will, since it is upper extremities, I need you to flex your fingers, flex and extend it for me. Okay, fingers, sorry. And then your wrist, and then your elbow, and then your shoulders, and then abduction, adduction, and anterior rotation and exterior rotation. Do you have any pain right now?
No.
Okay, so my patient was able to do that without any problems, which is good. The next thing we will do is we will quickly examine your radial pulse, and we will also do a grip strength, okay? So radial pulse is okay, so her radial pulse is strong and they're equal bilaterally. And we will do a quick grip test. So you're going to pull my, yes, so just pull. Okay, perfect. So my patient's grip was well, and they were both symmetrical bilaterally. And the next thing we will do is the lower extremity examination. So what I need to do is inspect your legs. So I don't see any lesions. I don't see any muscle mass. I don't see any pulsation. I don't see any deformities. I will quickly. Do you have any pain? No. Okay. Check the other side. Okay, perfect. No pain. So the other thing we'll do is I will quickly examine your pedis, your dorsalis pedis and posterior radialis. Okay, perfect. So my patient's pedis, dorsalis pedis and posterior pedis radialis was intact. They're both strong and they're equal bilaterally. That is good. The next thing I will do is we will do a dorsiflexion and a plantar flexion. Okay, so are you ticklish?
Yes.
Okay, so I'll try to be gentle. So I need you to raise, yeah, and then pull it down. Okay, so my patient was able to do that. She has no difficulty with that. And that includes our that includes our lower extremities. Now we will go to our thorax. So our thorax will be, we will examine your thorax area and mostly on your posterior areas. So I can see that your anterior thorax is intact. I don't see any lesions, any muscle mass, which is good. And then we will do a anterior posterior ratio, which is around 1 to 2. I will quickly examine your posterior uh, uh, thorax. I don't see any lesions. I don't see any edemas. I don't see um, any any pulsation, which is good. I will quickly palpate your uh, posterior thorax, and you let me know if you have any pain. Okay?
Okay.
Pain?
No.
Any pain?
No.
Okay, great. Okay, so that seems good. The next thing we will do is we will quickly percuss your posterior. I will percuss and hear for the sounds, okay?
Okay.
So I will place 2 fingers and tap on one. Okay, so that is very resonant. Okay, the only area that we will have a little dullness is under the clavicle, which is the shoulder blade, which is fine, but everything else is resonant. And the other thing I will do is I will do a quick auscultation of your thoracic areas. The first thing I will do is I will examine bronchiovascular. Take a deep breath for me. Okay, another one. Okay. And then now we will do a vesicular examination. I will start with the apexes of the lung. Deep breath. Another one. Another one. Another one. Last one. One more, sorry. Okay, perfect. So we can see that my patient's bronchiovascular sounds were medium. It was not very loud. And there is equal expansion of the chest and air entry is equal on all lobes. And then I did not hear any wheezes. I did not hear any other sounds, which is good. And then, okay, so the next thing we will do is I will do a quick examination. We will do a quick examination of tactile firmitis, and then we will examine also symmetrical expansion. So for I will place my hand on your chest and you say 99, okay?
99. 99. 99. 99. 99. 99.
Okay, so that was intact. The vibration was equal on each side. There was no other vibrations heard. Now I will do a chest expansion to see you have symmetrical chest expansion. So I will place my finger on your xiphoid process and you try to take deep breaths, okay? One more time. Okay, perfect. So we can see that her chest rose equally, and I don't see any cyanosis, which means my patient is breathing well. Her breathing is intact. She has no other problems. The next thing we will do is we will quickly examine the thorax for cardiovascular. So for this part, what I need to do is quickly examine. I don't see any lesions. I don't see any muscle mass. I don't see any involuntary movement, and I don't see anything else, which is good. So now the next thing I will do is I will examine your valves. So let's begin. Okay, so the first valve I will examine is your aortic. So pulmonic, deep breaths, and herbs, deep breath. And then we will do tricuspid. And finally, we will do your mitral. Okay, perfect. So I could hear as too strongly on aortic and the pulmonic. In the herb valve area, I could hear the both of them equally, S1 and S2. But as I went down to her tricuspid and mitral valve, S2, S1 was more stronger. So the next thing we will do is I'll quickly examine for any heart murmurs or any S3 and S4 sounds, okay?
Okay.
Okay, so I'll use the bell of my stethoscope. Deep breaths. Deep breath. Okay, so I did not hear any heart murmurs. My patient is good. She does not have any, I did not hear any S3 and S4, which is good. And I will do a apical heart rate. Okay. Okay, take a deep breath. Okay, so we can see that her apical rate is strong and they're regular. The next thing we will do is a abdominal examination. So what I need you to do is, if you can lie down for me. Okay, so the first thing I will do is I quickly inspect. Okay, so I don't see any lesions. I don't see any discoloration. I don't see any edemas, which is good. The next thing we will do is I will quickly examine the bowel sounds on all four quadrants. Okay, so the bowel sounds are fine. They're equal in all quadrants. The other thing we'll do is we will do a quick Bruit test. So I will start with aortic. Then I will do the right and left renal. Then I will do the right and left iliac. And I will do the left, right, and left femoral, which is fine. I did not see anything. Um, the Bruit sounds are normal. I did not hear any abnormal movement, any abnormal sounds, which is good. The next thing we will do is I will quickly palpate gently, and you let me know if you have any pain or any problems. Tenderness. Any pain?
Mm-mm.
Tenderness?
Nope. Nope.
Okay, so the next thing we will do is we will quickly do a Romberg's and examination, and
Okay.
you let me know if you have any pain, okay?
Nope. Nope. Nope.
Okay, great. So my patient has no problems. Everything seems good. The next thing we will do is we will do a muscular function examination. So I need you to sit straight. Okay, just sit this way, facing this way. So I need to do a examination of, I will place, let me grab this. I will place a object. Let me know if it's sharp or dull, okay? Oh, actually, I'll do it on your hand. So close your eyes.
Sharp. Dull. Dull. Sharp.
Okay, so that was the sensation test, which is good, it's intact. The other thing I will do is a light touch. I need you to close your eyes and let me know if you have the sensation, okay?
Yep. Yep.
Okay, good. And then also close your eyes.
Yep. Yep.
Okay, great. So that is intact. The other thing is we will do a position test. So I need you to close your eyes and let me know if your fingers are going up or down.
Up. Up. Down. Down.
Okay, perfect. My patient is able to do that. Her sensation is her position is intact. The other thing we will do is a stereognosis. I will be placing some object in your hand. You close your eyes, feel the object, and let me know what it is, okay?
It's a key.
Perfect. Okay, one more.
It's a coin.
Yes, perfect. So my patient is good. She's able to do that. The other thing we will do is we will do a deep tendon reflex test. So I need you to relax for this part. So the first thing we'll do is your bicep. So just relax your hand. Sorry. Okay. And the other thing we will do is triceps. Okay. We will also do radialis, brachioradialis. So just straight, keep your hands straight and relax. Okay, that was good. We will do patellar, Achilles, and then the final we will do Babinski. So keep your knees straight. Okay, perfect. Achilles. Okay, and the last one, if you're ticklish, it might bother you a little bit, but let's see. Sorry, I have to do that. So my patient is a little ticklish on her feet, but she was able to do, the reflex are intact and she's able to do it. The last thing we are going to do is your lower extremities. I need you to stand on your feet. So I need you to do a foot to toe walk. So you're going to put, yes, perfect. Okay, that's good. And I need you to do a toe walk and heel walk. And the last one is Romberg. So what I need you to do is keep your hands straight on the sides, close your eyes, and hold your position for 20 seconds. Okay, perfect. So my patient was able to do the Romberg's test and she did well. So that was our examination for today. Thank you for watching.